Good afternoon. As you may have heard, Governor Newsom announced the reopening of some businesses with restrictions. We're going to get into that and what that means to the County of San Diego and businesses here. We also have a lot of other ground to cover, so in the interest of time, we're going to get straight to the updates, and we'll start with Supervisor Nathan Fletcher.
Thank you, and good afternoon. Our forward progress in terms of reopening continues. We'd often talked about turning the dial, and today we are turning the dial. Additionally, per the governor's direction and order today, they are reopening and adding the following categories of business can be open in San Diego County. Office-based businesses, we continue to encourage telework, strongly encourage that where possible, but for individuals who need to be physically present, office-based businesses can resume their operations. Malls, this is just clarifying that both regular traditional malls, outdoor malls, outlet malls, strip malls, any configuration of mall can be open, but again, it is only for pickup or for delivery purposes only. So no in-person shopping, but all of those malls and associated retails can be open for pickup services. They've also added selective services that are able to be open. These include car washes, pet grooming, landscape and gardening. In addition to those, they've allowed outdoor museums and outdoor gathering spaces. All of those are be adding to the Stage 2 reopened businesses. We do ask that each of these businesses go to the county website and fill out our safe reopening plan. Simple document you download. You post that publicly as well as make it available to your employees. And with those conditions met and understanding the criteria outlined in there around hygiene, physical distancing, health screenings, and the other various components of those plan, those entities are cleared to resume operations in San Diego County. Again, office-based businesses, strong encouragement for teleworking where possible, but for employees where that does not work, can be present. Malls, both regular outlet malls, strip malls, are available for pickup only. Selective services around car washes, pet grooming, landscaping, and gardening, those services are open, along with outdoor museums and outdoor gathering spaces. The governor today also began to issue some guidelines for businesses that are not yet open, but they want to prepare. They issued guidelines for the restaurant industry, in particular for in-person dining. For San Diego County, this is just further things to think about as we anticipate and look forward to that further reopening. Those are not reopened at this point, but the state of California has issued guidelines for a number of industries for things that they should consider in their planning efforts in terms of what they're doing. This reopening phases that we continue in coincides with our continued efforts around testing, tracing, and treatment, which is a vital cornerstone of what we are doing. And we continue to build up our supply chains for all the various components that go into executing those tests, along with working out all the protocols and procedures for how people can best get entry point into the system, access the test, and how we can properly coordinate this with all of the various entities that are a part of the testing team and testing effort. We also continue our efforts around personal protective equipment. We want to continue to ensure that our frontline workers, our healthcare workers, our nurses, our first responders have the protections that we need. I believe we are now up over 3.6 million individual items of personal protective equipment we have distributed, and we continue to push to acquire and distribute more with all of those. And all of our efforts around ensuring the capacity of our healthcare system continue, both monitoring ICU utilization and total healthcare system capacity. To date, we have done a really good job as a region in terms of coming out this. We want that progress to continue, and we want to continue to move forward in terms of meeting our goals and everything that is out there and everything available to you. Before I jump into the testing slide, I just want to share with you that in San Diego County, we still have 3 state testing sites where any individual can make an appointment. I'll share the slide in a minute with the website and phone number that you will call to do those. But each of those sites are operating daily, conducting just under 800 tests a day. We ask if you make an appointment, you please fulfill that appointment. If not, you're taking a spot that someone else could have utilized. But the locations presently are at Grossmont College, the county's North Inland Livewell Center in Escondido, and the former Sears building in Chula Vista. Please don't show up at those sites if you don't have an appointment, but they are geographically spread throughout the county. And again, we believe those can do just under 800 tests a day. In addition to those sites which you can access without a doctor referral, you just go to the website or call the number and sign up. We're continuing to ramp up our county testing through our public health lab. We were working with our Live Well mobile office at testing sites in Southeast San Diego. We're also sending out the county's library bookmobile and other county vehicles to testing throughout the region, looking for hot spots or particular areas. Our targeted efforts around skilled nursing facilities continue, and we continue to take a multi-pronged approach to try and daily increase the amount of testing that we're doing. Quick update on the homeless at the convention center. 138 more tests were administered yesterday. We've now administered 1,126 tests to date. The totals presently are 359 staff have been tested. That's up 17 from yesterday. And 767 residents have been tested. That's up 121 from yesterday. The only change in the numbers is we have 2 new negative tests from what we reported yesterday, but no other change. With that, we will jump into our slides and move through these quickly. Yesterday, we were reporting 2,440 tests conducted. Again, a little bit of a lag coming out of the weekend. We expect these numbers to uptick. We're now over 84,000 tests total. We added a few more contact tracers and case investigators. We're now at 170, and we are expecting these numbers to continue to grow and move up towards our initial goal of 450. We expect the number we need will be more than that, but we will assess that as we see an increase in testing capacity and testing goal. We'll also have an increase in our contact tracers. You see 6,294 tests performed. We're currently treating 195 individuals in our public health motel rooms. Those rooms remain available to any San Diegan who has a positive test, who does not have the ability to isolate at home, and we continue to work with our healthcare system partners to let them know of this available resource and ensure that they are sharing that with their patients who might need that service. Next slide, you're going to see, this is the chart reminder. We've shown this before. If you'd like to sign up for the available state testing, you can go to the website listed there, lhi.care/COVID testing, fill out the information, and they will direct you to an appropriate appointment at the geographic location that is most convenient for you. You do not need a doctor's referral. You do not need insurance. You do not have to pay. You simply have to go through the process of signing up. You also can call the number there, 888-634-1123, to schedule an appointment. Today we're reporting 96 new positive COVID-19 test results. That is out of the 2,440 total that I mentioned on a previous slide. That is a 4% positive rate. Our rolling average for the preceding 14-day period is 5.1, and so today's total are a little bit below that. Again, one-day totals are not indicative, but the general trend that we are seeing here is trending in a downward trajectory as a percentage of positive. We expect that downward trend to continue as we continue to expand testing and as we continue to do more testing. We're down a little bit yesterday and today, a little bit of a lag from the weekend, along with a little bit of a lag for commercial labs reporting their segment of the reports. But we do expect these numbers to get back up in the range that we saw last week and continue to increase towards that initial goal of 5,200 a day. Daily hospital census is reasonably unchanged from yesterday. 144 ICU patients, 400 cumulative hospital patients that are COVID positive or COVID suspected in our area healthcare systems. And again, this is generally flat if you take into account the added hospitals that came into our system back at the beginning of the month. Moving on to the next chart, you will see our 400 COVID patients in our hospitals at the bottom, 3,694 total hospitalizations in San Diego County. And again, you can see that relative to current bed capacity, the dotted purple line at the top. Final chart is just our cumulative stats, 5,161 positive cases who are there. You see our estimated recovery at 3,124. Cumulative hospitalizations with a doubling rate every 35 days, cumulative ICUs with a doubling rate of every 41 days. And then we are reporting 15 additional deaths today. Those are 15 lives and 15 families who have been struck by this, and we extend our deepest condolences and sympathies to all of them and deepest thoughts to all of their families. With that, I will turn it over to Dr. Wilma Wooten for today's Public Health Officer's Report.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and thank you for being here. The global, national, and state statistics today are based on data from the Johns Hopkins dashboard, and these data were obtained about noon today. Information is as follows. Globally, there are over 4.2 million positive cases, including almost 290,000 deaths. Nationwide, the United States is reporting over 1,356,000 positive cases, including almost 82,000 deaths. Statewide, over 69,000 positive cases have been reported, and this includes 2,789 deaths. Today, the County of San Diego is reporting 5,161 cases, which is 96 more cases than reported yesterday, as well as 190 deaths, which includes 15 new deaths reported since yesterday. Of the total number of cases, the age range is from 3 months to 101 years of age. The demographics for age group 20 to 49 years of age is about 52%, which is 2,661 of the total cases. We still have 49% female and 51% male. There have been 996, or 19% of the cases, hospitalized. And of the total number of those hospitalized, 309, or 31%, have been admitted to the ICU. For the 190 deaths, these represent approximately 4% of the total number of cases reported today. Of the 15 additional deaths reported today, the age ranges from 56 to 92 years, and all of these individuals had underlying medical conditions. These deaths occurred from May 7th through May 11th. Of all of the 190 deaths, 43% were female and 57% were male. Regarding the race and ethnicity of the deaths, we have data for 90% of the 190, which means we are missing data for 19 of this total. Of the total, 46% are white, 42% are Hispanic or Latino, 7% are Asian, and 2% are African American or Black, and 1% each for Pacific Islanders, American Indians, and those of multiple races. My colleagues and I here at the county, we really send out our sincerest sympathies and condolences to the families and friends of those that have lost their lives to COVID-19, both in recent days and throughout this entire pandemic. As a reminder, all of our demographics are on our county website. The address is at the bottom of most of the slides shown here today and is also found directly in front of me. In regard to reported outbreaks in congregate and community settings, to date there have been a cumulative total of 63 confirmed active outbreaks. Of these active outbreaks, 41 are in congregate facilities, 1 new outbreak reported since yesterday. Total number of aggregate cases, the total number of congregate cases is 1,164, which includes 89 deaths, and 22 active outbreaks in community setting locations, which includes 241 cases and 5 deaths. Thank you to all of our San Diego residents who have cooperated with the local health officer order. Last Friday, the entire county transitioned to stage 2 along with the rest of the state. Today, the governor announced a few additional statewide modifications, which were reviewed by Supervisor Fletcher. The metrics are trending in the right direction, and we will continue to monitor these data as we continue to reopen up businesses. So now please welcome back to the podium Chairman Cox. Thank you.
Thank you, Dr. Wooten. We'll go directly to the questions.
Brandon Lewis, News 8, please state your question. Hi, I just wanted to clarify first, as to those curbside pickups, the car washes, return to offices, et cetera. When necessary, can they begin today? And is that reliant on meeting or other goals? And then if they are going to reopen, do they have to complete that safety plan prior to reopening?
Okay, Supervisor Fletcher will respond.
Yeah, thank you, Brandon, for that. They are free to open today. They do have to complete the safety reopening plan, the SRP, which is on the county website. But once they complete that plan and post it and share it with their employees, those entities we outlined as we move deeper into stage 2 as a county are available to open today, yes.
Great. And just as a follow-up, what would you say the biggest challenges facing the county toward meeting more of the requirements under phase 2? And is there a goal, maybe date that you have in mind that hopefully we can get toward the end of phase 2?
Well, where we are right now is we're moving consistently as a state. So we moved on Friday as a state into stage 2 with the initial retail entities that were outlined, that the governor outlined for every county. Today we took another step forward into stage 2. And at this point, we'll be awaiting further guidance from the governor on taking further efforts into stage 2. Now, we know as a county that we have some work to do around continuing to build up our testing capacity, around continuing to build up our tracing capacity, continuing to ensure we have all the personal protective equipment. But those are things that we're going to be doing throughout the duration of this coronavirus evolution. And so at this point, we will continue to do all of those things, and we'll continue to await further guidance from the state. We saw the movement Friday on a pretty significant opening of businesses. We saw an additional step forward today with additional businesses just a few days later that are now open, and we will see what happens in the coming days and weeks.
Okay, let's go to the next question.
Shalina Shatlani, KPBS, please state your question.
Hey, I'm wondering if you could give some more details on how the county plans to approach the governor's news about restaurant dine-in reopening. So I know that the guidelines are listed, but can that happen, sort of immediately? Like, how are you going to be assessing, which restaurants can be ready for this?
Okay, Supervisor Fletcher will respond.
Yeah, thank you for that question. I want to be very clear. The only businesses that are allowed to reopen now are the office-based businesses, the malls, the select services that we outlined, landscaping, car washes, pet grooming, outdoor museums, and outdoor space. The restaurant guidance that he provided is just guidance, so restaurants can begin to prepare and think about how they will operate in-person dining. It is not allowed at this point, and there's no indication from the governor when that will happen. It is more just them sharing guidance about things restaurants should be preparing for. I think it is foreshadowing that at some point in the near future we will get there. But as of today, there is no in-person dining in San Diego County, and we don't have a date for when that will happen. I will remind you that we shared our safe reopening plan well in advance of a number of businesses being able to open. We wanted to say, this is the plan, this is what you'll need to do when we get the green light. We have gotten the green light on a number of sectors of stage 2. Those businesses can open. We have not yet gotten the green light on in-person dining, but the governor did share guidance about the types of things they need to prepare for and anticipate when we get there. Does that make sense?
Yeah, that's great.
Okay.
I just have a question about the contact tracing. So you had mentioned today that there are close to around 200 now that have been hired. I was wondering if you could share some more information on sort of in this, and you all talked about this before, but the hiring process, who you're looking for, how it's representative of diverse communities that are here in San Diego. We all speak a number of different languages,
Yep.
so are you going to be releasing details on sort of who's being hired for this?
I'm going to let Dr. Wooten walk you through the hiring process and what we're doing, because the county's actively engaged. But I can tell you it is a high priority that our contact tracers have to be culturally competent. They have to speak the appropriate language. They have to have the appropriate backgrounds, because what these individuals are doing are reaching out and talking to San Diegans who have been a close contact or been exposed to someone who's positive, and they're walking them through the steps for them to get a test, the things that they need to look out for, the availability of services for each of them. And so we are going to ensure that our contact tracers reflect the broader demographics of San Diego County in an effort to truly fulfill the mission and the intent of what they need to do. And so that is a high priority for us and something that we place a premium on ensuring we do as we go through this process. And I'll let Dr. Wooten share with you a little bit more about the hiring process.
Thank you, Supervisor Fletcher. So in terms of the hiring process, the call for individuals to apply for the position of a contact tracer was placed a couple of weeks ago. It closed. We had a large, almost 1,000 individuals that had submitted applications. And in the past, since Friday, we have trained on Friday and Saturday, 74 individuals. We have 30 that are being trained today and 30 more that are being trained tomorrow. So our goal is to have almost 180 individuals in this first round, and then we will go through another round of trainings until we reach our initial goal of about 450. But the actual number that we will need will depend, as has been stated at the state, it can be as high as 10 contacts per case, or it could be 6. So we will continuously, as we have our case investigators conduct the investigation for each case, that generates the number of contacts, and we will hire accordingly. I also, we have 170 individuals that are already on board as case investigators, and they are also doing high-level contact tracing associated with outbreaks. So those are the two major categories: our case investigators and our contact investigators or contact tracers. Any other questions related to that?
Just one more. Wondering if the county is planning on working with any community nonprofit organizations around sort of cultural awareness, as mentioned.
Yes, and I neglected to add, as I have reported last week, that we will also be bringing on promotores to be extenders of our contact tracers. So we are looking forward to working to do that, so that we have that additional support to go out and find people or locate individuals as a part of the entire contact tracing effort.
Thank you.
Okay, let's go to the next question.
Matt Hoffman, KPBS, please state your question.
Hi, in terms of restaurant dining, I know that obviously the guidance from the governor today came down, but you guys said no date yet from the state. In your regular conversations with these state officials, are they giving you any indications, for restaurant owners who might be listening right now, when that green light might be coming down? I understand that you guys have to have clearance from them in terms of reopening them in general.
Yeah, Supervisor Fletcher.
Yeah, Matt, we don't know exactly when it will be, and it would be irresponsible to try and predict that. What I can tell you is we're in stage 2. We took a step forward on stage 2 on Friday. Today's Tuesday. We took another step forward. There are not a lot of entities left in stage 2, as outlined by the state of California, to get to. In-person dining is obviously one of those. What I would encourage all restaurants to do, a number of restaurants are open now for delivery and takeout, is to really spend some time digesting the state guidance, the guidelines that they have put out, and really think about how they will adapt their operations to meet those guidelines, and then have a plan in place so that if on short notice we're told, hey, you're cleared to go, that you are as ready as you can be. And then we will all just continue to stand by for further guidance. So we don't know, and it would be irresponsible to predict or guess when that may happen, but hopefully soon.
And then following up on that, I know some restaurant owners are wondering, will they need to submit these safety plans to you guys at the county, or do they just need to have them ready? And do you think that these state guidelines, like checking guests, checking workers, are they realistic, do you think?
Well, if the guidelines are realistic, would be a restaurant by restaurant determination. Not every restaurant is the same, and it certainly wouldn't be my place to say what every restaurant out there might think about the guidelines. What I can tell you is that we've tried to have a simple and consistent framework for businesses, which is we have our Safe Reopening Plan, our SRP, and that is for every business that is out there. And they need to download that, they need to print that, they need to post that, they need to share that with their employees, and we try to make that very easy. Now, in our Safe Reopening Plan, there's a section there for additional comments. And so if a particular industry is doing unique things because it was recommended in the state guidelines, that is where we can outline that. But we want this process to be as easy and as seamless as possible. And so the state has shared guidelines. These are guidelines for folks to consider, but they can work those guidelines into the SRP, Safe Reopening Plan. They can post them, share with their employees, and they are cleared to go. They do not have to send them to us for approval. They do not have to wait for any of that to come back. We are trusting that businesses will be good faith actors and will act responsibly, both in the interest of their employees and their guests, and protecting their public health, and we believe that that's what has happened to date, and we believe that's what will happen in the future. So you don't submit them to anyone for approval. You simply download our form, you fill it out, you can use the state guidelines to help you think about what you're doing, and then once you get the green light to open, then away you go.
Thank you.
I have a question from Saddam from Univision, and it is related to the guidelines, and he is wondering if the governor's announcement today changes San Diego's guidelines that we have in place.
No, the governor's announcement doesn't change our guidelines. Our guidelines, our Safe Reopening Plan that was adopted by our Board of Supervisors, is the framework for businesses to open. And again, we're trying to make this as simple as we can. You simply download that form, fill it out, post it, share it with your employees, and then you can open. The various guidelines that are coming out that are industry specific from the governor are things that should inform your thinking and things that you should be thinking about in your operations. Some of those might be things you incorporate into the comment section or other areas on our plan. But once a business in stage 2 is cleared to open, they simply fill out our Safe Reopening Plan and they are good to operate.
And his follow-up is San Diego County close to meeting the criteria to move quickly through stage 2?
So we are moving through stage 2. We took a step Friday. Today's Tuesday. We took another step forward. At this point, the accelerated opportunities are simply not available to urban counties. There are, I believe, 29 counties in California who meet that threshold. We are not one of them. As the guidelines to move at an accelerated space separate from the state are written, we will never meet them. So barring a change in those guidelines, we're going to continue to move forward consistent with the state of California. If that changes in terms of what those guidelines are or the approach from the state, you all will absolutely be the very first to know.
All right, thank you.
This next question, I think, is in reference to a letter that was sent to the governor.
Yes, and this is also from Saddam. And has there been any response from the state to the letter asking to allow counties to ease restrictions?
Well, the quick answer is no, but in fairness, that letter was just sent yesterday afternoon along with a copy of the Recover task force that was put together by Mayor Faulkner and myself. So we look forward to a response from the governor, but I know he's got a lot of things on his plate, so we'll give him a day or two. Next question.
Yes, this one is from Lamore Abrams, from CBS 8, wondering, given recent events showing short-term rental travelers getting out of hand and partying, I'd like to know if the county health department will begin requiring incoming travelers to isolate themselves for 2 weeks, as other states are doing.
Okay, Dr. Wooten will respond.
Well, certainly there were a lot of hot spots throughout the U.S., but CDC does not have any guidance, and we follow CDC guidance and recommendations, and their current guidance for travel restrictions is related to international travel. So we are not requiring anyone traveling from within the United States to quarantine upon arrival. There's actually no way to know that they are here, so it would be impossible to do that. Now, regarding the Airbnb, that's a different issue, and we provided information about that in answering a question yesterday, and our plan is to we're in the process of generating communication with Airbnb, because doing that actually that's gathering. And in stage 2, there is currently 0 gathering. So that would be in opposition of the current health officer's order, as well as the state and the governor's executive directive.
And Dr. Wooten, I have another question for you, and this is from Mike McKinnon from KUSI. San Diego is the 2nd largest county in the state of California and the 5th county in the nation, 5th largest rather.
Yes.
The governor came out last week with the gating criteria that any county would have to follow in order to move forward into stage 2 and beyond. This included a standard of no more than 1 case per 10,000 and 0 deaths over a period of 14 days. In your medical opinion, is this an attainable and appropriate standard? And if not, how might the gating criteria be changed to accommodate counties like San Diego that are more densely populated?
So first of all, the gating criteria are federal criteria, and that is not the criteria that Supervisor Fletcher just spoke of, and that has been asked about in terms of metrics for accelerating through stage 2. As Supervisor Fletcher stated, no urban health department will meet those 2 criteria. And that was by intention and design. So we will never meet those until metrics have changed to transition from stage 2 to stage 3. So please understand, we will never meet those 2 metrics. It was not designed for large counties to meet those 2 metrics. The metrics as currently published and issued are for smaller jurisdictions. So just want everybody to be very, very clear on that.
Thank you. Dr. Wooten.
This last question deals with our county employees who will be coming back to work, and Supervisor Fletcher is going to respond.
This is from Brandon Lewis from CBS 8. In light of the allowance to return to office work, are county employees going back to the office if they're working from home?
All right, thank you, Brandon. We're going to continue to encourage teleworking where it is a viable option and where it can meet the need. But we will begin phasing in some return of county employees back into county operations with some beginning as early as this Friday and continuing into the coming weeks in a phased approach. There won't be any offices that serve the public on this Friday, but we will begin that process, and we will also be updating what offices are open and staffed in an ongoing basis. So in short, we're going to continue to rely heavily on telework and utilize telework, but where needed and where appropriate, by the end of the week, we think we will start phasing in some of our county workers back into county offices, but again, nothing that's publicly facing this week.
That concludes our questions for today. Last week was Nurses Week, and we celebrated Nurses Day, where we certainly give thanks to all of our public health nurses and those in hospitals and clinics fighting this pandemic. To add to that, today is International Nurses Day, which also honors Florence Nightingale, the founder of modern nursing, whose 200th birthday is being celebrated today. She laid the foundation for professional nursing with the establishment of her own nursing school in London and many other accomplishments. I'm sure she'd be impressed today with how far nursing has come and seeing the dedication of nurses during this crisis. And on a positive note, yesterday I mentioned the work of the Rock Church and its volunteers in repairing damaged masks. Well, today in the San Diego Union, there was an article talking about the San Diego Opera Costume Shop, which is developing a prototype mask with a clear shield over the mouth area to help those of the deaf community who rely on lip reading. I think that's a great example of the great ingenuity that we have within the San Diego region. Well, there's an old saying about when you know the opera is over. Well, you know, this briefing is over when I get up to speak one last time. So have a good evening, and remember, stay in place, maintain space, and cover your face. Thank you.